Welcome to InjuryGuru.com. I'm Carla Schimmelfinnig, registered physical therapist, and this is the start of the shoulder impingement exercise program number 2. So if you have had a decrease in pain and you're finding you can do some of those things that you couldn't do before, then most likely you're ready to go on to this exercise program. So let's talk about that pain a little bit more specifically. If you would say that you have had at least a 30 to 50% decrease in your pain from when you first started with this whole exercise adventure, this exercise program, then I would say you are definitely ready to move on to this next phase, this program number 2. If you would say that, if you can't put it in a percentage, but you would say, yes, I'm definitely having less pain. Maybe you can sleep better, you can reach better behind your back, up over your head. Then too, I would say you're ready to move on to this program. Let me just give you a warning though. If you start this program and you find that your pain is actually increasing, then I want you to stop right away. I want you to go back to that first exercise program, do that for another week, and then try this program again. With this program, I'm going to introduce some weights. So I've got some dumbbells, a soup can, and even some TheraBand. So if you don't have dumbbells or TheraBand, don't worry. You can just use a soup can or anything else that you might have at home that has some weight to it. So just make sure that if it increases your pain, you want to stop, back up for at least another week, then you can try this again. I always have to give another warning, which is if you get to the end of this program or any other program and you find that there's little to no change in your pain, or you would say that your pain is worse, then definitely listen to your body. That is your body telling you that you need to go see the doctor. You just need more intervention. And there are many things that can be done for the shoulder, from injections to physical therapy. So it may be that you just need something else. You may need to see a physical therapist that can really get their hands on that joint and improve that whole situation. So don't wait. Just make sure you get to the doctor. Let's see, what else can I tell you about this at this phase? Another thing I want to remind you about is just posture. So I nagged a lot about posture in that first exercise program, and I'm going to mention it again with this program. And if I were there to nag you on a daily basis, I would most likely do that about posture. It's that important. So if you happen to have a job where you are sitting a lot, make sure that you're sitting with really good posture. You can just make sure that you've got that arch in your low back that I had talked about before. You can even purchase a McKinsey lumbar roll, and you can get that on Amazon for anywhere from $17 to $20. Also in the first program, I told you that I did not want you going above a certain level with your shoulder motion or with your arm motion. So in this program, I'm going to let you go to that level, and as long as you tolerate it, as long as it doesn't increase your pain, then you're good. You're just going to keep on going. I want you to commit to this program for 2 to 3 weeks also, just like the first one. And again, if you find you're doing better and you can just return to all the things that you need to do and there's little to no pain, then I'm really happy for you, and just get on with life. If you find though that things are better but you're still having some pain, just stick with these exercises a little bit longer. They certainly aren't going to hurt, and it should only help you get to that end goal or that point of no pain. So let me show you the first exercise in this exercise program. You should be familiar with this one from the first exercise program. We're just going to add some resistance to it. The first exercise in this program is called shoulder flexion with your elbow bent, and you should be really familiar with that from the first exercise program. It's just now we're going to add some resistance to it, or some weight. This is just a can of beans from my pantry. You can use this. This is fine. It's not, obviously as heavy and as specific as dumbbells or TheraBand, but if you don't have those, you don't really want to go out and get those, just make sure you use something like this for resistance. Alright, so the first exercise, that shoulder flexion with your elbow bent. If you'll remember, elbow bent to 90 degrees is this position here, or with your hand facing straight out in front of you. And as I said, you can go all the way up to that 90-degree point or shoulder level now with these exercises. So that is what this one looks like. And you can see I'm going all the way up to shoulder level or straight out in front of me, or what we call 90 degrees. Let me show you from the side. Right, so you can see I'm just going straight out to that shoulder level or 90 degrees. Right, so let me show you that with some dumbbells. Generally, I tell my patients, or I have my patients do both arms at the same time when they're doing this, because if you're doing one, you might as well do the other. So if you have two weights, then go ahead and get the good arm some exercise too. And for this one, it looks like this. And again, you can see I'm going all the way up to that 90-degree point or shoulder level. And that's what I want you to do now, as long as it does not increase your pain. All right, let me show you with a TheraBand. You want to put one end of the TheraBand under your foot, and the other end, you can put a loop in that, tie a knot and make a loop for your hand, or just hold on to the end of it. And it looks like this. So my arm, same position, same movement. I'm just going to be pulling up on that TheraBand. Now, I do need to warn you, the TheraBand is pretty tough because the further you stretch a TheraBand, a rubber band, the harder it gets. So just be careful with this. Make sure you choose a resistance that is not too heavy, or just don't choke up on it so much. Don't leave yourself just a short little distance to pull just because it's going to be a lot tougher. How many do you do of these? So now I want you to do 3 sets of 15 repetitions, and you're going to do that once to twice a day. I'd really prefer you to get in twice a day still at this point, but at least once a day with all of these exercises. Make sure you still put some ice on that shoulder if that was helping and you're still having some pain, irritation. Make sure you put ice on that shoulder. You can still do that 3-4 times a day. View the rest of the videos in this program and get started, and let's see if we can't get you to that end goal of no pain and getting you back to doing all the things you want to do.